Namaste. Leave no one behind. In this episode, the primary challenges faced by well-meaning governments, who are also members of the United Nations organization, are revealed using the SDGs as the basis for comparison. At the same time, information from other sources has also been referred to inform and understand the country's justification for their falling short of targets agreed upon. One very important issue is the quality of governance, which is an indicator that reflects the utilization of resources and the development of appropriate policies and procedures that not only reflect national interest, but are grounded to address the needs of the citizenry. I have used governance indicators shared by the World Bank for their consistency in using indicators across countries. While no assessment can be 100%, I feel the methodology and justification to be reliable. Do refer to some of my other presentations. The two UN SDG goals mentioned in this review regard health and well-being and clean water and sanitation, both of which are strong indicators of survival and development. Survival in terms of making clean drinking water available to all and having household and community waste disposal to control pests and diseases, which has been adopted only in the modern age. These topics are not covered in detail, as many sources advocate alternative approaches and offer recommendations, while I'm covering these topics just to make us all better aware of the challenges faced in achieving the goals countries have committed to and reflect on the reasons for their poor performance. Where do we stand halfway to 2030? The lack of progress towards the Sustainable Development Goals is universal. Still, it is abundantly clear that developing countries and the world's poorest and most vulnerable people are bearing the brunt of our collective failure. This is a direct result of global injustices that go back hundreds of years, but still play out today. The compounding effects of climate, COVID-19, and economic injustices are leaving many developing countries with fewer options and even fewer resources to make the goals a reality. However, insufficient progress has been made in areas such as reducing maternal mortality and expanding universal health coverage. Globally, approximately 800 women died every day from pregnancy or childbirth in 2020, and 381 million people were pushed or further pushed into extreme poverty in 2019 due to out-of-pocket payments for health. Most member countries were non-starters regarding addressing their citizens' health, well-being, and water sanitation needs. If we believe that the aim of having a healthy population is to improve the nation's status, then the citizens' ability to perform to their optimal capacity is a critical factor. The extent to which the citizen is physically and mentally able to effectively contribute to the growth of their family, community, and nation entirely depends on the care they receive during their growing period. The nurturing of the citizen is essential during all stages of their life cycle, during which the caregivers prioritize their commitment to support this development. While all countries aim to provide their citizens with the services and opportunities to grow and develop, most are unable to provide the consistency desired due to political choices and resource constraints. Good health is a state of complete physical, mental, and social well-being. But are the targets realistic? I present a more detailed assessment in my next presentation. Clean water and sanitation means having access to safe drinking water and hygienic facilities for human waste disposal and washing. Despite great progress, billions of people still lack access to safe drinking water, sanitation, and hygiene. Achieving universal coverage by 2030 will require a substantial increase in current global rates of progress, six-fold for drinking water, five-fold for sanitation, and threefold for hygiene. But are these targets realistic? I present a more detailed assessment in my next presentation. It's always easy to be critical of anyone's progress, especially when you think better could have been done. However, when in the position of duty bearer, irrespective of the level you choose, country, community, or family, the challenges faced influence the decisions made, especially when confronted by limited resources, a high debt GDP ratio, and a slow growth economy. If the nation is in conflict or affected by constant epidemics, it makes the nation even more vulnerable.